I'm Pinkal Desai. I'm a physician at Weill Cornell Medicine, and I specialize in the treatment of acute leukemia, myelodysplastic syndrome, and myeloproliferative disorders. As a medical student, my mother went through cancer, and a few of my family members also were diagnosed with cancer. That's when I really got interested, and I wanted to make a difference in this field. It's very scary to hear that you have acute leukemia, and I really make sure that my patient understands that I'm going to treat their diseases in the best possible fashion, that their age is not a factor, that based on their medical problems, we're going to target treatments, we're going to make plans that the patients can go through and actually have a good quality of life at the same time. Everybody who has a bone marrow disorder, leukemia, MDS, or myeloproliferative disorders, we sequence their cells and find what makes these disorders specific for that patient. We want to personalize treatments. We want to identify which mutation or which genetic abnormality can be best targeted with existing drugs and newer drugs, and that's how we personalize these treatments. We have exposure to the best laboratories that work with Weill Cornell Medicine within our department. We monitor patients early on to make sure that they're responding in the right way. For example, if you have a particular mutation, then we follow that mutation regularly while the treatment is ongoing, and that helps us decide whether the response is appropriate or can we switch the treatments or make something better so that we can get the best outcomes. It's important that the patient is treated as a whole and all other comorbid conditions are addressed. At Weill Cornell Medicine and NewYork-Presbyterian, we have exposure to all these subspecialties of medicine. We rely on the intensivists, on the cardiologists. We make sure that they get the best possible care, not just with leukemia, but also some of the other diseases that they might have, to make sure that we get the best possible outcome.